So these are the 10 things I tell my patients who are struggling with their mental health, the last being the most important. Who am I? I'm Dr. Matthew Gloudeman. I've worked in the crisis team, a mental health hospital, and I take on the most complicated mental health cases at my GP practice. Why? Because I know that if you're struggling with your brain, that's your most important organ and you need help. So what are the things I tell my patients? I say, think of yourself as a tabletop, and all the legs you put under that table, that's what's going to support you during this most difficult time of your life. So what are the legs? One might be medication, and that's a discussion with you and your doctor to figure out the right medication for you. And that can be a bit of trial and error because nobody's done a clinical trial on you. You're genetically unique, the environmental social factors are unique to just you. The next one, therapy. Now there's lots of different ways to consume therapy. Maybe you read about it. Maybe you like watching YouTube videos of lived experience. Maybe you like one-on-one therapy with a therapist to do EMDR, CBT, bereavement support. The next one, a robust support system around you. Talking to as many family members, friends, colleagues that you feel comfortable with so that they can support you during this time, because everybody's touched by mental health. And if they don't understand, bring them to your GP or the doctor that you're looking at, because I encourage my patients to come in with family members so I can explain mental health to them as well. Next one, regular follow-up with your healthcare professionals. I book my patients in sometimes the next day or in a couple days if I'm really worried, and it's unique to each patient. The next one, these are things you can do yourself. Your diet. I say eat a low glycemic index diet. I'll put a link down below what I tell patients to eat. Exercise can feel daunting if you're struggling with your mental health, but that leg can get built up over time. Maybe 5-10 minutes a couple times a week to start, and then you build from there. Sleep, super important. Regular sleep every day, same time. Going to bed, same time you're waking up. Supplements. I live in the UK. We don't get a lot of sun here, so vitamin D with a multivitamin is really important. I also tell people to take omega-3, and new emerging research on creatine can be beneficial for your mind if you're taking like 10 grams a day. So I do that too for just the cognitive benefits and the workout benefits from it. One of the last ones, avoid toxic things. Toxic food, toxic people, alcohol, illicit drugs. The last one, build a robust list of people you can call if you feel hopeless or suicidal. The crisis team, the ambulance service, the A&E department, your GP, your friends, your family, so that tragedy doesn't strike, because that would be terrible. Please call someone if you're struggling.